Joseph from CI Optometrists. In September, it's National Eye Health Week, and I wanted to talk to you about all the different images and data we take as part of every one of our eye examinations at CI Optometrists. Here are my results from my eye examination last week. First of all, I've got some pictures of the outside of my eye, right and left, allowing us to monitor any changes to the structures of the surface of my eye. Here's a zoomed in picture showing my lens. This is where you'd see a cataract. For me, I have a few little pigment deposits on the outside of my lens, on my left eye, and this shows that in more detail, seeing the pigment dots round here. Again, imaging it like this allows us to monitor for future reference. The next bit of data I'm showing you comes from our DNI scanner, and this represents how out of focus my eyes are. I'm short-sighted. We should just see a dot of light here. These wide circles show a measurement of the focus, or lack of it in my case, of my eyes. We've then got higher order aberrations measured. This is measuring scatter that especially affects you at night, and this is why people don't like driving at night. For me, I've got a fair few higher order aberrations. These are the blur left over even after I'm wearing my glasses. We can then take a map of the cornea. Here's the surface of my left eye measured. The colours represent the contours, a bit like a map of a hill. And then I've got a measurement of the outer surface of my eye. This is my right eye and shows the length of my eyeball, the thickness of my cornea, and the shape of the front surface of my eye. Here's some further measurements of the opacities measured within my eye. These little dots here represent the epicapsular stars we saw earlier. Next, we're having a look at some retinal images, and first of all, our OptoMap retinal scanner. This is my right and left eye. This allows us to look at the nerve for glaucoma, macula for macular degeneration, blood vessels for the effect of diabetes, and then the peripheral retina. For me, I have a hole in my retina. You can see it down here, which I have to monitor carefully. This shows how the image allows us to zoom in on any imperfections and look at different perspectives. You see a general photo and then a measurement of the back and front of that structure. And most importantly with all of this technology is monitoring. So this shows a comparison, looking on this side at 2021 and comparing through to my test last week. Luckily for me, you can see it doesn't look any worse. Then we have an OCT scanner. This machine scans through the layers of your retina. And here we're looking at the left macula. There's a photograph, and then we've got a slice through the retina at this turquoise line here. This is the gold standard for macular degeneration. These numbers represent the thickness of the retina, and green means within normal limits. 247 microns in this section, that's a quarter of a millimetre. Here we have a 3D map of my macula. The next measurement is the same machine, but looking at my optic nerve. This is where we'd see glaucoma. Again, we have a photograph, and then the green slice through the middle shows us what we're looking at here in cross-section. This is the same data, but represented differently. The hot colours representing the thickness of the nerve bundle. Again, this would get thinner if you got glaucoma. This allows us to monitor for any changes that we might see with that. Last but not least, we're looking at the visual field. This is the peripheral result. And here's my left visual field. So 0% false positives. That shows I wasn't too trigger happy. Here's my blind spot. We should all have that. That's the optic nerve. It shows the test has worked. Finding a blind spot we know to be there. These numbers represent how accurate I was. And it gives me a score here. So I did all right, 100%. Here's the same thing, but looking at a comparison. This is now my right eye. So we've got my results from 2022, and later in the same year in August, and then 24 and 2025. And these here allow us to plot that result with time, showing if I'm deteriorating. All this technology allows us to look at the health of your eyes, but more importantly, monitor things with more accuracy, allowing us to be sure if things are changing, and allowing us to make sure we do our very best to look after your eyes in the best way possible.